Good morning. It's my great pleasure to introduce our first speaker, Reza Jafari. Reza and I first met about 2 years ago at the United Nations right up the street at the Global Education and Technology for Health Summit. And he really educated us a lot, given his perspective on the role of public-private partnerships in the information and communication technology sphere. And we've become good friends ever since. If I took the time to read his CV, we wouldn't have time for his talk, so I won't bother with all of the wonderful details, other than just to say that Reza is the CEO of eDevelopment International. He's also a member of the Broadband Commission, the International Telecommunication Union, and many, many other organizations, and he's going to share with us his lessons learned from public-private partnerships in the information and communication technology industry. Reza, welcome.
Thank you very much. Good morning, ladies and gentlemen. Bob, thank you very much for your very kind introduction. It's been my pleasure to get to know you and to have this opportunity to be here in New York. New York used to be my hometown for many, many years, over 10 years. Now it is my second home because I live in Annapolis, a small town in Maryland. This is my first time participating in this wonderful forum, but I promise you it is not going to be my last time. So I promise to Clarion and to Pat and to many of you that I had an opportunity and pleasure to visit with, that I would love to come back and share more thoughts and some more ideas with you. Bob made a wonderful introduction of me from what I have done, but I can make my introduction in one line, if I may, and that is I'm a social entrepreneur. After many years in the private sector and doing many things in other parts of the world, I call myself a social entrepreneur. That means I do good, and I make good, and I feel good. Well, a couple of years ago when I was telling a group of folks sitting, an old lady was sitting in front of the line and says, well, and you look good too. I said, Mother, the beauty is in the eyes of the beholder. So that's my introduction. Today we are here for the next 30 minutes or so that we have together. I'd love to share some thoughts, some ideas, some experiences that we have learned in the information communication technology sector that happen to be, and it is so fortuitous that I'm following Simon because he spoke about the Millennium Development Goals and now Sustainable Development Goals. And I would like to tie these two pieces together and to see where we are in terms of the information communication technology, tied into the healthcare and the healthcare ecosystem, and then share with you some of the things that I have learned through my experience, again, just like many of you have, and try to give you a framework about 9 factors that I have been able to put together. It might be 10, it might be 11. I would love to share with you again to see what other things we can do with those factors, that those are the critical success factors of public-private partnership. Now, 2 things I need to share with you before I move on further. First, at the end of my talk, if you agreed with everything that I said, I have failed. Number 2, I'm here also to learn. This is not just for me again to share my thoughts, some ideas with you, but I'd love to learn from you because I sincerely believe in and subscribe to the long life learning. So lifelong learning is my goal, and I'm sure, again, you all would be sharing your thoughts, your experiences with me as well. See if I can get the wing of this. So we talk about public-private partnership. We all are facing, again, Simon mentioned about the past 15 years or so when we talk about Millennium Development Goals. And the goals that we set before ourselves, and again, many areas that were covered from women's health to child and mortality health, field, issues, the hunger, water, energy, and other areas. Information communication technology was not on the forefront of anybody's mind. Year 2000, when we first came up with the Millennium Development Goals, everybody thought, well, there's something going on in the background called internet. Nobody cared about it. Nobody knew what is going to happen. But during the past 15 years, information communication technology has proved to be a facilitator, an enabler, who can put many of those pieces together. And we also played a very, very important role in the whole process. And that is, it is not only for communication technology where we can work with the vertical sectors, and it goes beyond it. We can bring the vertical sectors together. And that was the reason we built the UN Broadband Commission. The UN Broadband Commission came into existence in 2009, 2010. We've been around for the past 5 years. President Kagame of Rwanda and Carlos Slim of Mexico, one private sector and one public sector. This is a good model, I guess, for public-private partnership. They are co-chairing the UN Broadband Commission. I've had the pleasure of serving in this commission for the past 5 years, and now we are approaching the next phase or the next chapter of the Broadband Commission as the Sustainable Development Goals come together. Our intention was being able to create the ecosystems that they can work together and use the public-private partnership as a business model who can facilitate and who can enable implementation, execution of those processes as well as those goals and objectives. As Simon mentioned, the Sustainable Development Goals are 17 now. They've extended, I guess, expanded. ICT is in a couple of places. I'm not worried that health is in one segment, but again, as you said, there is one goal, but 99 targets underneath it. So I guess each of those targets can be, again, another goal as well. What I'm interested in, again, what we have done, again, under the UN Broadband Commission and also at the ITU, International Telecommunications Union, I had the pleasure of chairing the board of ITU for almost 8 years now, is that we need to create environments, we need to create models, we need to create processes that the vertical sectors can come together. I would like to share some thoughts, some ideas in terms of what we have done in our own sector, and then bring it to the healthcare continuum of care, and share with you a little ecosystem that I built on my own from what I have learned from many of you, Roger Glass, who's not here, and Bob Bollinger, who's here, and some other folks who are not here, that they told me a little bit about the healthcare industry. So I was able to put something together called the health ecosystem. And I would love to have your opinion, your ideas, and your input, because the healthcare ecosystem, it is not it's a standalone by itself. It involves many, many other groups, and it is not static. It is very, very dynamic. So the healthcare ecosystem that I built past few days or so was past few days. This morning probably has changed, and this afternoon is going to even change further. So the UN Broadband Commission came into existence because we felt information communication technology can help to bring many things that the information communication technology can facilitate is going to happen. Healthcare was one of them, education, government, agriculture, manufacturing. And these are all pieces that we felt we can help using the public-private partnership model, business model, and create those ecosystems that they can help each other and being able to deliver the expected results. Now, throughout my conversation and experience, I learned about the new, okay, sorry. No, I just couldn't hear, okay. There we go. This is the new definition that I came up, and it may or may not fit what you think the public-private partnership is. Having spoken with some of you, and again, Simon's introduction was a great one, it's the public-private partnership. This is not your father's public-private partnership, so to speak. This is a new way of looking at public-private partnership. But again, as I said, this is one perspective. We can change it. We can modify it. You folks can help me to make sure that this is appropriate. It's a multilateral, multi-stakeholder, multi-level. It involves government at the state, local, and the national, international levels, private sector at the local, regional, international level, academia, NGO, and one thing that was missing for many years, we built public-private partnerships around doing something for people, but people were not part of the model. So we need to make sure that representatives of the community that we are going to serve, the representatives who are going to be the beneficiaries of the outcome of this public-private partnership, are going to be also part of this process as well. Now, I'm going to ask a couple of questions from you folks because that is going to help me to move the process a little bit further. How many have you been involved? I know probably the answer, but I'd like to see again, hands up. How many have you been involved in the public-private partnership initiatives? How many of you have been successfully implemented and delivered the outcome and the results that they were expected? How many of you have seen the results were not the expected results that you were anticipating to happen? Thank you, Claire. And how many of you experienced unintended consequences that you were not planning for it? Thank you. So that gives me an idea in terms of what we need to do in terms of making the public-private partnerships more successful. Again, as I said, I call it 360. You can come up with any other name you want to, but we wanted to make sure that the entire community, the entire sphere is being covered. I'm going to ask a couple of more questions in terms of why public-private partnership? We talked about it is a good business model, but why is it even coming together? So there is one word in English language that I believe is probably one of the most powerful words, besides God, country, love, and family. Can you help me with a couple of those words that comes to your mind? So what is that most powerful word? Justice, trust, empathy, collaboration. I felt necessity is a very, very important word in the English language when it comes to public-private partnership. Each of us are representing different organizations from the academia, from public sector, from private sector. What is the ultimate goal that each of us have for ourselves in our private lives as well as for our careers that we wanted to achieve before we pass on and we go start our dirt nap, so to speak? Any thoughts? Well, making a difference. The intersection of making a difference and the necessity, from my perspective, created their need for public-private partnership, especially the 360 that I shared with you. So you combine the two, becomes a business model that you see the need, you see the demand, you see the necessity for a community or for a purpose, and then you wanted to make a difference before you move on. Now let me bring it to the continuum of the health. This is, again, I'm not trying to teach the pre-med students. You folks know much about healthcare that I do. I've learned this from my friends like Bob and Roger and folks, and my wife, who happen to be a professional in the healthcare community as well, that this is a continuum of health. We have the primary interventions, secondary, tertiary interventions, and returning to wellness. Wellness, prevention, immunization, education, part of the primary intervention. Secondary, early detection, and screening. These two parts alone, that is normally part of our public health, if you will. If we just pay attention to the first two boxes, if we start promoting and executing plans and public-private partnerships in these two areas, they're telling me somewhere between 50 to 60% of our healthcare problems are going to be solved. And that is where public health comes in. If we pay attention to wellness. Clarion was telling me he still fits in his uniform of many years ago because he takes care of himself, because he knows how to prevent, how to make sure, again, he's well maintaining his health and his body and his health. And of course, the result of it is coming back again to the primary intervention as we move on. What about the health ecosystem? I have one word to tell you about the healthcare ecosystem, and that is extremely complex. How complex is it? it is more complex than you can even imagine. I don't want to read every single element that you see in here because some of you can identify, well, that's me, that's me, that's me, that's my organization, that's the group that I work with, that's the government by itself. It is more than just one little cloud that you see back there. It's all the elements that goes on the government. From the Department of Health and Human Services to NIH, again, all the other affiliate organizations that all comes together. So it gets really, really complex. So how we can make this complex organization to work in such a way that has been focused on a specific goal, focused on an evidence that is going to be delivered at the end, and the outcome that has to be delivered at the end, and still believe that is working and then moving on as we go along. Well, these are the critical success factors, again, that I shared with you at the outset, that I have been able to identify as I move throughout the world. I've been involved in somewhere in the neighborhood of about close to 40, 50 of the public-private partnerships. In my industry, there were over 300 public-private partnerships during the past 15 years. From the privatization of the telecommunication companies to the creation of the largest submarine cable system in East Africa. And let me share you some of the thoughts, some of the ideas that has come up, and I felt again it might be appropriate to share. One of them is called Smart Africa. President Kagame, who was the co-chair of the UN Broadband Commission, has come up with the idea of turning Africa into a smart Africa. I'm sure some of you are familiar with 8 other countries, 9 countries altogether at this stage, decided we're going to raise $300 billion and turn Africa into a smart Africa. What does that mean, smart Africa? Again, I have the pleasure of working with President Kagame on this initiative. This October of this year, October 28th, 29th, and 30th, we're going to be having our second Smart Africa initiative in Kigali, capital of Rwanda, as you know, and kicking off a series of initiatives and projects that is moving on. For this initiative, and this is something, again, what may not be familiar with some of you, but I'm sure some of you would appreciate and you have been involved in. We brought ministers of information communication technology, ministers of health, ministers of finance, ministers of education, ministers of agriculture. They're all under the same umbrella, told them, you need to work together. You can't just sit back and say, well, this is not health, I'm not going to touch it. And for years, each and every one of these organizations have been facing lack of resources. Simon talked about funding. The money is a big issue. Everybody wanted to chase the same target. Everybody wants to approach. But I'm Minister of Health. Just give me money for health. The other person is education. Give me money for education. The other person, well, let me build you infrastructure. I can build information communication technology. Well, the broadband is there. Well, what is in it? What is on it? So the cooperation and collaboration of these groups have been very, very important and a part of the mandate. If you cannot work together, don't come to this party. So the ecosystem that we talked about, that brings, again, all the other actors and the players in such a way that now we have a focus, and our focus is on the end user. We wanted to know who the individual or the corporation or the entities, if they're schools, if they are hospitals, if they are community health clinics, what is the focus that we have to have? And we have to make sure that focus is on the end user. The second part that has been coming up throughout, again, the experiences and the ideas that we shared, we wanted to make sure that the vision has been jointly developed and has been shared. And the outcome, the deliverable, is also being shared. We don't want to have one minister saying, well, my intention is just build the infrastructure. No, Mr. Minister, with all due respect, your Madam Minister, with all due respect, this is not the only purpose. We wanted to make sure that the infrastructure of the broadband is going to be utilized for reaching this joint goal that we've developed. Another example in Rwanda was President Kagame, again, as many of you know him or know of him, very, very progressive leader in Africa. He decided I wanted to open my country's door to other players to come in and help me out. So he was not able to convince their own information communication technology companies, telecommunication companies, wireless and broadband mobile, to reach out to the rural areas. So he contacted anybody in the world who was interested coming to Rwanda and building a public-private partnership model to be able to provide broadband services to the furthest parts of the country, a landlocked country as we know. Of all the people who were interested, he chose Korea Telecom. Korean Telecom coming from Korea, joining a public-private partnership, providing a wholesale service together with the country of Rwanda and making it available to 700 villages that they wanted to have access to broadband. And people who are living in those villages can buy this wholesale service from this entity and sell it at retail. Are you with me? We're creating jobs here. We're not just providing broadband. Providing it to the community health centers. We're providing health services. Taking it to the schools and libraries. Now we are helping the education. So this was another example that the joint plan was developed and we were able to move this project forward. It is now up in a full swing. The next part, of course, is the sustainable business model. In another talk that I had a couple of weeks ago in London, somebody told me about, well, let's just try a pilot. I said, pilots are not a good word to use. So why? We can always use pilots. I said, there are close to 9,000 pilots in the developing world, believe it or not, and there are probably more than that or a little bit less than that they all come to existence, they deliver something, they run out of money, they run out of people, they run out of support, they run out of sustainability, they get out of the way. Or they just become dormant. We have a pilot somewhere going on. They said, well, what would you recommend? I said, instead of calling it pilot, let's call it phase 1. Because when we call it phase 1, somebody says, what about phase 2? Somebody says, what about phase 3? If you're looking for funding, this is your funding for phase 1. Then we need to have more business model for phase 2 and phase 3 and so on and so forth. So that was one of the comments that came up in terms of making sure that the business model is sustainable. It is not something that we just try it, pilot it, didn't work, or it worked, there's no other place to go. Are there any questions or comments at this stage? Okay, I'll move on, but remember, if you don't ask me a question, I'm going to ask you a question. The next part that is really the sweet spot of public-private partnership working together is sharing the risk and the rewards. Now, the rewards that I expect as a private sector might be different from the rewards that the public sector is expecting. But we need to make sure that we are taking some risk and we're taking some rewards. The example that I used in Rwanda, the country said, I will give you licenses at no charge. I give you tax benefits for the next 20 years. I'll give you access to real estate to build your antennas, to build your towers. That is my contribution. My reward, I want to provide broadband services to my citizens, and I want to put content, health, education, and other services on that broadband. The private sector says, well, that sounds good. I'll also like to do this, but I also like to make money. That's okay. Many times we feel that the private sector shows up, the only thing that they're looking for is money. And if there is no money, they're not going to show up. And that is true for some corporations, from pharma to information communication technology, and for that matter, anybody else. But if we approach in the right angle, we approach with the right question, if we come up with the first 2 boxes of developing the plan and the goals and objectives and targets together, then our business model becomes more sustainable. Then we would be sharing the risk and the rewards. This is a big one. It is easy to bring the ministers under the same roof and saying, well, we have the Minister of Finance sitting there, Minister of Health sitting there, Minister of Education, Minister of Agriculture. But any of those individuals, he or she is running a totally different world. I am following my regulatory environment, regulatory framework. That's why they called me healthcare. The agriculture says my world is different. finances, my role is different. And all of these organizations, especially at the regulatory level, have been acting like silos. They don't talk to each other. They sometimes go against each other, believe it or not. If you're building infrastructure for telecommunication companies, Minister of Finance is not your friend first, because they're asking for license fees. And the license fees are so expensive that you cannot build the infrastructure. And after you build the infrastructure, they've taxed you so much, you can't even operate. So for years, you're operating in red. But if they're working together, they realize, instead of me, Minister of Finance, charging you 500, 600 million or billions, the most recent one back in the States, $40 billion for license fees, I will take that money as a part of the process during the next 5, 10, 15 years. So the pressure would not be on you, because I know after this license, you have to pay invest on people, invest in products, you invest in technology to build the infrastructure. Then you have to put products on it to offer it to the people. Then let's just work together and make sure this is an environment that we both can benefit. So the regulators need to talk to each other. Regulatory frameworks need to think about the future and the future of the ecosystem together. Claren and I were talking, please go ahead.
Before you go any further, I have a question for
Yes,
you, and that is, this all sounds great, but many of these places have been taken advantage of. There is a negative history of people coming in. Do you have any insights on how to get past that point in any negotiation or arrangement? Because the land is just strewn with wreckage of people who've come in and promised things and never delivered.
Yes, absolutely, because again, that goes back to the first few boxes. If you don't start with the first box, that we are going to develop this goal and those goals objectives together, you're not going to be able to go anywhere. Many times it happens, they just jump in the middle of it, that they say, well, there's a group of us got together yesterday and we said, we wanted to build this. Or somebody shows up from the Department of Education that says, I wanted to build a new educational system for my country. And since people cannot come to me, I want to go to them. I want to make virtual health a possibility. If people can't come to a doctor, the doctor is going to them. But then if that meeting of the mind, and if that agreement that is not in the first place in place, you're absolutely right. And I share with you about the education. Many times in our educational system, we are teaching our students, whether they're in elementary school, in a high school, or even in college, things that by the time they graduate become obsolete. We're teaching them to solve the solutions that they're good for yesterday's problems, not for tomorrow's problems. But if you wanted to focus on the next 20 to 25 years, we need to have a different mindset and different models of working together. And that's where it needs to come in. Any other comment? This is another big one as well. Especially in some of the developing world. But I have a bad news for all of you sitting around the table. That is not only the problem of developing world. We have it in the developed world as well. I lived in Germany for 3 years. A lot of people didn't know that German government was one of the most corrupt governments in the world. Worse than some of the African countries that we all know and think and have read in the newspapers. Things are changing. There's in Asia, there's India, there's China. Everywhere that you look at it, it is not only attached to one particular area of the world and saying, well, this part of the world, they all corrupt governments, and corruption is the centerpiece of these countries and the economies. But the governments has to be very, very transparent, and it has to set the accountability. We're talking about measures and metrics, and this is the place that you can enforce how those metrics and measures are being delivered, and how being evaluated, and how being delivered. So this is, again, another area. Again, I'll be more than happy to ask any questions or any additional comments in coming up. I asked you about the question of unintended consequences. Well, if you don't know the consequences that's going to happen, it's going to be unintended. But there's always a plan B, there's always a plan C. Those of us who are coming from Washington, we all know about the mid-course adjustments and alignments, I guess. In the middle of the road, or those with the Army, Navy, and Air Force background, you need to align yourself and you need to align your resources, you need to align your plan as you move on if something happened that you were not expecting to happen, if something happened that was not part of the original plan that we all talked about. Since we don't know what's going to happen, we all need to be flexible, and that is the flexibility that comes to this model, that if something happened that we were not expecting, something might happen even a good thing, something might happen was not a good thing or expected. We need to have a plan, a contingency plan for those unintended consequences. Excuse me. The public-private partnerships, they have not succeeded, and they have failed. Although many of those elements that we discussed already are part of the plan. But then when it comes to innovation, you talk about innovation again, Simon, this morning. I'm glad I'm following you. It's a hard act to follow, but I'm doing my best. The collaborative innovation is the name of the game. You cannot just do it by yourself. The days of doing it all alone is long gone. The collaboration, it is not only, well, we are doing collaboration, we have a business model, we have a shared risk and reward. But I cannot just take all the innovation, put it under my tent, and not to share with the other member of my ecosystem that is sitting there, or the other groups that I'm comparing notes and cooperating and collaborating. So the collaborative innovation, it is becoming the name of the game. As a matter of fact, this is one area that has been getting so much attention nowadays, and we've created a lot of terms like the innovation economy, knowledge economy. They're all focusing on innovation and things that we can do. And this is the last element of this whole process, this 9-step. Again, I'm sharing with you this framework, and I'm sure again you all know it, you already have tried it, you already have some experience with it. May not be exactly in the same order, but I'm sure each and every one of you have done this before. We need to make sure that every cycle that we go through this process, there is an improvement model, as a process built into the system that says, let's take a look at where we are, let's take a look at where we were supposed to be, let's see again what happened in terms of unintended consequences, let's see what happened to the results that we were expecting, let's see what happened to the business model, and start improving it as we move on. So that becomes a full cycle, if you will, so to speak. And that gives you the critical success factors. And the private-public partnership 360 as a template. And now I'm going to ask you a question unless you have comments or reactions. Please, Joe.
I'd like to ask, it really starts with your first slide, because this is a really incredibly useful concept. But you pointed out that 50% of the morbidity, mortality, yes. Premature, unnecessary, would yes. be tackled by primary, secondary, yes. attention to the primary, secondary segments of the health yes. continuum. Yes. And the fact is that most of the resources are in the tertiary. It's true in this country, it's true in most countries. Yes. And that's where the business opportunities are, yes. largely, in the healthcare sector. So could you talk a little bit about how you get win-win situations for business in the primary, secondary segments of this enterprise?
Absolutely. Well, great question, Joe. The reason that I'm trying to bring the healthcare continuum and the information communication technology together and talk about these first two boxes in particular, let's see if I can go back to make sure everybody's together, is that information communication technology for years has been missing from the healthcare. Although we've been touching and using technology from this primitive world of using, again, from centuries ago, to the most recent one. But these two first boxes are the parts that you and the patient are in the most closest contact. But it doesn't mean that the contact can be all in person. One of the issues, I'm sure you have discussed this before, is the capacity. We do not have enough primary care physicians. We do not have enough nurses. We do not have enough nurse practitioners. We do not have enough community health workers. So how can I provide and extend my capacity of the healthcare without waiting for a long time, or without expecting the universities and colleges and higher educational institutions are going to train and provide and produce the knowledge base that I need. So we use technology to be able to, again, as I said, if they cannot come to the doctor, if they cannot come to you for help, now you're going to them. And that is the place that has helped a great deal of being able to use mobile technology, broadband technology, being able to pass on the information in such a way. Again, one of the areas, since my wife's specialty is women's health, she's telling me the reason that the breast cancer is having such a great success stories, especially during the past 10 or 15 years or so, that we can see reduction of the breast cancer mortality is because of the early detection. The same thing is true probably for prostate cancer. If you can do early detection, you're going to increase the chances of survival, multitude again, depending upon how early you were able to detect. And many pieces of it is going to relate to, were you taking care of yourself? How we can prevent the disease from happening. Now, this is besides the chronic disease, again, as we all know, although some of it is also preventable. They're saying obesity is preventable. Hypertension is potentially preventable. All these genetic matters and all the other issues come in. But still, you can prolong it. Now, you folks are the members of the healthcare industry. I'm just looking at Bob, whose area, again, is near and dear to my heart in terms of infectious disease. A good piece of it is preventable. Please.
So, Reza, I just want to follow up on Joe's question. What's the business incentive for corporate partners to get involved in those early steps? I mean, we understand the public health incentive. All of us, the reason for the question is we're trying so hard to find ways to develop public-private partnerships that address those first two boxes. Public health people get it. Health ministers get it most of the time. But how do we get the businesses and the other partners to come into that ecosystem for those first two boxes?
Great. That's precisely
yes.
Exactly. I'm glad you brought it up again. The most important asset of my corporation, I spent 12 years with Hewlett-Packard and 30 years with another corporation. The most important asset of my corporation was people. If I can help corporations to have more productive people, don't take time away from work because you were not feeling well, because you were not taking care of yourself. If I can make sure that the people who are coming working for me are healthy and they're with high productivity, that is a great asset for my corporation because that's where the people are. If we can just bring that one element from the private sector and telling them by doing so, as many of you know and all of you know, it is now the minute clinics of CVS and Target and those folks who are going to take care of this part as a part of their public health. And some corporations, again, when I was still with Hewlett-Packard, we had a health center inside the main offices. We had 8,000 people on our campus. We felt it would be good to have a nurse practitioner and 2 nurses and the health clinic inside the office so we can provide the service right there if it needs to be. You're putting health information services on our everyday. Have you done your fiber? Have you done your vitamins? Have you taken care of yourself? Have you done your exercise? Have you done your walk today? Have you drank your 4 gallons of water today? All those messages and all those elements, again, on a small scale, but if you can extend it and expand it, it's going to help the corporations to have a much productive, much healthy workforce to be able to help. Please.
So if you don't mind, I'll push a little bit
Please.
more on this.
That's the way I learned, Bob.
We had a nice discussion yesterday about corporate health, and there are a lot of excellent, interesting models out there we heard about. And that's certainly one clear incentive for corporations to get involved in those first 2 boxes. But from a global health perspective, for the broader community, I mean, the obvious ones are things like access to early diagnostics. And there may be some markets there. Early diagnosis means earlier treatment, perhaps, so there are more customers for the pharmaceutical industries if you're able to identify people that need treatment. But where else can we find opportunities to engage the corporate sector beyond occupational health and safety issues?
It is more than the customers for pharmaceutical companies. These are the consumers. If the consumer doesn't feel good, they will not buy your products and service. If they don't feel good, they don't buy your garments and your clothing. If they don't feel good, if they have, again, their first priority is wellness and health, they will not be able to have this discretionary income to be able to spend on something else. So again, if you start making this picture a bigger picture, you're absolutely right. And that's the place, because I cannot sell my products and services in the consumer goods, or for that matter, even business to business, unless I have customers. Now, a couple of days ago, in Florida, I was running a session with this group of senior executives. I asked them this question. I said, when you go to your customer, what do you tell your customer? I said, well, I'm here for you. I said, well, what else? I said, well, I'm here for you. I said, well, it's necessary but not sufficient. You need to tell them I'm here because of you. And because of those consumers, the corporation survives. No matter what line of business they are, again, consumer good or B2B, you wanted to make sure that the consumers, that also, from what level they're workers, but they're also consuming and using our products and services. And the other side, they are producers. That's going to be the goal that needs to be articulated. It has to be measured. It has to be put in the plan that the corporations understand it is not just you're doing it for the goodness of your heart. This is not just like the Verizon Foundation or Vodafone Foundation spending some money and saying, well, this is my part of social responsibility. This is good for business. And I'll be more than happy to convince them, because we have measures that says, by doing this, you can increase 5 or 10% of your productivity. By doing this, you can increase 10%, 15% of your consumption, because the healthy people who are well taken care of, who are using prevention and possibly getting early detection, they can be better customers and better consumers than those who are not. I don't know whether I'm answering your question or not.
Thanks. No, Reza, I've got, let me take 2 or 3 more then. So if you
Yes.
want to speak, please raise your, that's got Kathy,
Hi.
Then Gary.
Kathy
Please.
Taylor, University of Notre Dame. Thank you for that framework, and it seems right. I mean, it seems like yes, we need to check all those boxes. So my question is really about how organizations go about, as they're entering in partnerships together with their partner, operationalizing that. Because frequently you get into those situations and you don't really have people with the right expertise, or you don't really have the time or the resources to work through all of those steps and to check all those boxes. And it seems to me like we almost need like partnership professionals, you know, and mediators that are neutral and making sure that both sides are you know, doing the right things. So do you have any comments about how you've navigated that?
Great question, Kathy. Thank you. Well, again, as I said, that's my first time attending this forum. I've been reading a lot of it, thanks to Rachel sending me all the information. This forum can play that role. This forum can champion some of the work that needs to be done through those public-private partnership models. Let me share with you what we did at the UN Broadband Commission. In 2010, when we started the UN Broadband Commission, there were less than 14 countries who had a broadband plan. Today, there are 164 of them. What did we do? The members of the commission decided we would like to be the champions and ambassadors of going to the governments, because we have, again, just like this group, we have a different perspective from academia and from public sector and the private sector. Let's just go to those countries. Let's talk to those partners of ours who are willing to listen, that having a broadband commission is the first, having a broadband plan is the first piece of the continuum that you need to have. So 5 years later, 164 broadband plans. Now, how many of them being implemented? Probably less than half, which goes back to the second part of your question. Now we need to put the reinforcements behind it, and that has to come from both sides. If we can make sure that there is a risk and reward for both of those entities, if there is a deliverable that both entities agreed with that 360 public-private partnership, then we can start moving it to the next step of implementation.
So, Reza, when you mentioned it's good for business, you mentioned a few reasons why it's good for business. And I also want to point out, and I'm going to characterize this as sort of the secret formula that I think most companies haven't figured out yet, that when you learn how to focus on unmet societal needs, partner with government, other stakeholders, possibly UN agencies, NGOs, to address those needs and do so utilizing the core competency of the company, you have identified a way to enter and grow in new markets. And I heard a quote about a year or so ago that the bottom of the pyramid today is the middle of the diamond in the future.
Yes.
And we've already seen over the past 15 or 20 years in many emerging countries how a growing middle class has created prosperity and enables, in theory, companies to expand their access. But unless they learn how to do this, it's not going to be the traditional business models of salespeople carrying bags pushing their products into the market. It's going to be partnering to identify and building trust, how to address unmet needs. So there is a real opportunity. When I speak later, I'll give an indication of how much impact this has had for us.
Great. Thank you very much for the comment. That is very, very important. I want to just follow with two quick examples. About 25, 30 years ago, when people talking about China and going to China as the extension of their business, international business, you would hear this line: there are a lot of people, but they don't have any money. There are a lot of people, but they don't have middle class to buy my products and services. Now we know what happened to them, right? I was sharing this with Clarion. To me, Africa is where China was 25 years ago, 20 years ago. This is the place that we can help, again, based on what the comments that Bob was making and the questions. If we can build that middle class in Africa, this is the place that we can help them to fish, not just giving fish. We can help them, again, to your point, being able to have a better understanding for the private sector that you're actually creating not only the competencies, but profitability segments of the products and services that otherwise didn't exist because these are new markets.
Cheryl?
Hi, I'm Cheryl Christensen, Procter & Gamble. We are a company lucky enough to also have clinics on site for our employees around the world,
Yes.
about 200 of them. And we went on the path of creating a culture of health internally, including how we think about that, what signals do we provide, how do we make it easy to make the healthy choice, and reinforce with education, and try to do it in a way that our employees would engage it and not feel like it was Big Brother. And we think we got a good start with that. It's kind of a movement that's gone on. It's what we call a pull strategy instead of push. So it's been totally voluntary by our sites around the world and our employees to participate. But now, to your point, what else? Good for us, right? It's not perfection by any stretch of the imagination, but we have just taken the time to relook at the current vision and strategy, and we think it's time to move from something like healthy people, healthy business, on to how do we lead happy, healthy, meaningful lives, which means it's about a lot more than just are we healthy. Because we know it takes a lot out of an individual to make bold moves like changing lifestyle habits, changing what you eat, other habits you may have. And so what's the big reason for that? Something deep inside each one of us, we think. So we're going to probably be moving from this culture of health on-site, inside, on to how do we help each individual in the company understand where they are and what they're up to in life and what's meaningful about it. And then allow ourselves to formally commit to connectedness, not only within our families within P&G, but with P&Gers and their families outside, but more broadly to connecting with communities. We've seen many, many examples of that around the world. Outside of corporate headquarters, people can be a lot more creative and do a lot greater things, it seems, and so they have. And we're listening, and that's the direction we're heading, because we think it's really important to get at what you were saying.
Great comment. Again, this is the place that, again, not trying to promote information communication technology, that's where the connectivity comes in. That's where the connection comes in, that you're not only in your corporate environment to have access and privilege of having access to this information, but now this information is going and reaching out to the families and communities and beyond. Great comment. Thank you.
Reza, thank you very much for kicking us off in such a great way. Would you please all join me in thanking Reza? Thank you.
Thank you.